Hi, I'm going to present the paper Prompt2Perturb text-guided diffusion-based adversarial attack on breast ultrasound images. At first, we want to answer the question that why it matters in medical domain, especially breast ultrasound domain. First, lack of training data due to privacy and the fact that ultrasound is not the primary tool in breast cancer detection make users use pre-trained model and fine-tune them on their own data, which increase the vulnerability to attacks. Second, the cost of wrong prediction is more in medical domain rather than natural domain. Moreover, current approaches like FGSM and PGD cause distribution shift, and newer ones like Diff-PGD need pre-trained model in that domain. As a result, we exploit a new adversarial weakness to inspire work to defend against such attacks. Our framework is based on the stable diffusion, consists of text encoder, image encoder, and UNet. We diffuse the image with an input prompt like ultrasound image of benign tumor in breast and then denoise it and pass it to a classifier, which in this study are ResNet, DenseNet, and SqueezeNet. All the components are going to freeze except the text encoder part, and we update that part based on the loss function, which we talk about it in the following. Our loss function consists of two parts. First, adversarial loss, which is maximizing cross-entropy loss, and MSE loss, which is a diffusion loss. This combination balances between effectiveness and stiltiness. There are some studies that they show that latest stages of denoising process are about details and high-frequency things like borders, while the earliest stages are about the core shape of image and low-frequency materials. For editing images, with keeping semantics, we can optimize only on late stages. This can enhance our efficiency. So in this study, we find t equal to 50 step is a good candidate. So in forward process, we add noise up to t equal to 50 and then do the rest. Moreover, even with t equal to 50, it is very slow if we want to generate images by subtracting noise in a loop per each iteration in adversarial optimization. Inspiring by DDIM paper and some accelerating method for inference of diffusion models, instead of using multiple-step reverse process, we are going to do one-step reverse process. The formula here is just a reformulation of the forward process. The reason we can do that is that we are near images and we don't lose too much information. By this trick, this implementation is now doable based on the time efficiency. Then, as a final step, we do our iterations, saving each attack that successfully fooled the classifier. And then, out of the successful attacks, we choose the image with the lowest MSE score, the most similar to the original images. Here we present qualitative results comparing successful adversarial examples generated by different baseline methods. As you can see, the perturbations in PGD are quite noticeable and exhibit a structured pattern. When you zoom in, subtle artifacts are also visible in FGSM and Diff-PGD. In contrast, the image produced by our method, P2P, remains visually almost identical to the original. This highlights the ability of our approach to generate high-quality, realistic perturbations that are difficult to distinguish. We evaluated our pipeline on 3 publicly available breast ultrasound datasets using 3 different classifiers, ResNet, DenseNet, and SqueezeNet. For evaluation, we report several metrics, including success rate, LPIPS, SSIM, and FID. On this slide, we are showing the result for 2 of the datasets, while the third is included in the paper. However, it follows a similar trend. As the tables show, our method significantly outperforms others' baselines in terms of LPIPS and FID, indicating superior perceptual quality and distributional similarity. We also achieved competitive performance on success rate and SSIM, demonstrating the robustness and visual realism of our adversarial examples. This presentation concludes a brief overview of our work. For full details, experimental results, and implementation specifics, please refer to our paper. You can also find the code and additional resources on our GitHub. If you have any question or would you like to collaborate, feel free to reach out to us directly. Thank you.